Okay, so now we are going to look at endotracheal intubation and some other important points related to ETT tube. Endotracheal tube is the placement of a specialized tube into trachea for airway management, and the indications of endotracheal tube intubation is to secure airway and to supply oxygen to the lungs, and for general anesthesia it is used, and cardiopulmonary resuscitation it is used, and also ventilatory therapy in ICU intensive care unit. Endotracheal tube is intubated, and these are all indications of ETT tube. So next one is there is different size of ETT tube according to the age of the patient. Now ETT tube from 0 to 1 year is 2.5 to 3.5, 1 to 3 year is 4 to 5 millimeter, and 6 to 10 year is 6 to 7 millimeter. For adult female is 7 to 8, and for male is 8 to 9 millimeter ETT tube is used. So we also require some other equipments for ETT, that is laryngoscope, Megill forceps, stat, syringe, source of ventilation and suction is necessary, and it is very important to have all these type of equipments with you for ETT tube. Now the mnemonic to memorize this is SALT. SALT. S stands for suction, A for airway, L for laryngoscope, and T for the tube, tracheal tube, endoscope, intubation tube. Now different size of cuff with ETT tube are there, as you can see. According to the age of the patient there is different number, but in male it is used 8, and in female 7 is used. So this is very important thing that you have to memorize. And these are different sizes of laryngoscope. Different blades are there. There is a video laryngoscope is also there, and a little LCD laryngoscope is there, which is very helpful for ETT tube passage these days. Megill's forceps, as you can see, of different sizes, and then there is a syringe, and to inflate the cuff. Okay, so this is suction machine. Suction machine is used for suctioning the all secretions, and it is very important during ETT tube passage. Then the technique that we apply for ETT is we have to give the sniffing position to the patient, and then we have to look at the airway and Malampati classification that justify that what kind of ETT tube will be used for the patient. So extension of it length to occipital joint and flexion of neck is there. Then we have to open the mouth of the patient and insert the endotracheal tube inside trachea with the help of laryngoscopy. Hold the laryngoscope with left hand irrespective of dominant hand. Open the mouth with the right index finger and the support of the thumb. Introduce the laryngoscope from right angle to the mouth. Shift the tongue to the left. Go in. Press over the tongue. See epiglottis. Lift it and watch the vocal cords, which is very important. You have to look at the vocal cords. Their size, their opening, how they are visualized. As you can see in the image, the technique that is holding the laryngoscope, open the mouth with another hand, deviate the tongue to the left side, and look at the laryngoscope, vocal cords. Then take the tube in the right hand, introduce it under the vision, confirm the placement by auscultation, and also look at the chest. If tube is cuffed, inflate the cuff with the syringe, and then tight it with the knot. Are tube are connected with the source of tube. Confirmed by auscultation, chest expansion, bag movement, and end tidal carbon dioxide. This is very important step while placing endotracheal tube, because many times ETT tube goes into the esophagus and patient can collapse. Now connect the tube with ventilation support, ambu bag, anesthesia machine or ventilator. Whatever you are going to do, whatever your purpose is, you have to take care of that. There are some side effects, like there can be tachycardia, rise in the blood pressure, increase in secretions, laryngospasm and bronchospasm can happen. So you have to take care of that. A tube can go into the esophagus. Endobronchial intubation can happen. Trauma to the lip or mouth, or bleeding or leakage or cough or sore throat, barotrauma can happen in the lungs. Effect of ETT tube is increase in supply of oxygen can happen to give general anesthesia. It is used to improve exhalation of carbon dioxide. ETT is used. Then after the purpose, we have to remove the tube and we have to extubate the patient. It is advisable if cause is treated, thoracic suction is done, laryngoscopy, reflex, oxygen, adequate respiration, level of consciousness, and then extubate. These are the steps that you have to follow for extubation. Or failed or difficult intubation, if mouth is not opening, Malampati classification is not that good, one may require to extubate the tube and then we have to remove the tube. So in this way we perform endotracheal tube and the procedures related to that.